Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Nothing as such, and thanks for inviting me for the podcast. Epilepsy is one topic which is very close to my heart, and it needs a lot of understanding. There are a lot of myths, a lot of
Yeah,
misconceptions about epilepsy that needs to be cleared.
yeah.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, seizure or epilepsy, as we call it. So, seizure is just one episode, and when the patient has one or more seizures which are repeated, then we call it epilepsy. So, seizure or fit or convulsion is the name of the same thing, which usually happens due to sudden electrical discharges like a short circuit in the brain. And when that happens, there is sudden loss of consciousness, or there are abnormal tonic-clonic movements like this. The patient can eyes can uproll, the teeth get clenched. So that's the typical seizure that we call it. So
Okay.
it is also known as convulsions or fits in the layman terms. So people come with us to us in the OPD calling that the patient has fits. So
Yeah.
fits is obviously a layman word which has seizure as a scientific terminology.
What is epilepsy?
Yeah, so epilepsy is when somebody has one or more episodes of seizures, uh, which are recurrent. For
Yeah.
example, if somebody can have just one episode of fit, which can be because of any trauma, any other cause. But if that person has repeated episodes of fits, then we call this patient to be suffering from epilepsy. So, epilepsy is a disease in which an individual has more than one episodes of fits or seizures.
What are the different types of seizures and do they affect people differently?
So seizures and or fits, as we call them, seizure or fit can be of multiple types. But to understand it easy for general public, it can be divided mainly into two types. One
Yeah.
is generalized tonic-clonic seizures, which everybody knows about, the major seizure or a grand mal seizure as we call it, in which the patient hands get clenched, the body gets tightened, there is clenching of teeth, uprolling of eyeball like this. So we call it generalized seizure. Then there is another type of seizure which is known as focal seizure. Focal
Yeah.
seizure is when the patient has one body movement, for example, either on the right or on the left.
Mhm.
And there is one more type of seizure known as partial seizure. Partial seizure means patient will not have this tightness of body. Patient
Yeah.
will be unaware of the surrounding. For example, I look like this. I started look like this, and I'm not responding to commands. So this can also be a seizure. Problem is that general public considers a fit or a seizure only when there is clenching of a tightness of the body and the patient loses consciousness. While
Yeah.
transient loss of awareness to the surroundings, for example, the patient just starts looking at a point and doesn't stop responding. That can also be a seizure. So the seizures are of two types: generalized, in which there are like tightness of the body, and then there is partial seizure, in which you just lose awareness. There is no tightness of the body, and it lasts transiently, and the patient comes back.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So mostly epilepsy is due to some chemical disturbance in your brain. So, which can be from birth, which can be acquired, but most of the time it is acquired. It is not from birth. So,
Yeah.
it is due to some chemical imbalance in your body, and there is short circuit in the brain. But the other causes, which can be the cause of epilepsy, could be brain bleeding in the brain, trauma to the brain, any accident, any clotting in the brain, tumor in the brain, some chemical imbalance. For example, if the sodium goes too low, if the calcium goes too low, if the
Yeah.
patient has severe infection of the brain, all these can cause seizures.
Yeah.
But epilepsy, usually in patients of epilepsy, more than 80% of epilepsy patients will come to us with a normal MRI scan, normal EEG, with no history of any such episode. So mostly the epilepsy is caused by the chemical disturbances, and that is why the MRI as well as the EEG is normal in these patients.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So one of the important sign and symptom is if somebody around you is losing awareness to the surrounding transiently, then that is a matter of concern. Like for example, if the patient has tightness of the body and if he is losing consciousness, anybody can recognize that that person has epilepsy. But if the patient just loses awareness for a second, for example, I am talking to you and suddenly I stop responding for a minute, I become like
Yeah.
this, I start staring at you and stop responding. This is
Yeah.
also epilepsy. Most of the time, these are small clues that the attendants or the caregivers actually miss. So if somebody around you is losing awareness repeatedly, if somebody around you is like you find him to be lost in something repeatedly, then you
Yeah.
should think about epilepsy being one of the reasons.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
So the story is very old. So in the long time, whenever somebody has a seizure like this, people used to think that there is some aura or some like divine power that has been there, and there has been stigma with regards
Yeah.
to that the epilepsy spreads from one person to other. It is a disease in which can spread by touching, by drinking
Yeah.
the water from the same glass, by eating the foods together. So these were the stigmas that were there with epilepsy. So
Yeah.
epilepsy is not treatable. It is genetic. If somebody has epilepsy, his or her children will also have epilepsy. Epilepsy is not treatable, not curable. These are the myths that have been there. In fact, so much so that patients who have epilepsy, instead of going to the doctors, the neurophysicians to get them treated, they go
Yeah.
to the alternative form of treatment. For example, they can go to the nearby faith healer. They can go to the alternative form of medicines, herbal medicines. They'll go around doing window shopping with with various things, and they'll not consult the right doctor. uh,
Yeah.
while it is not true, because most of the patients who have epilepsy actually can be treated, and almost 70% of them can be cured. And for example, if you have a small lesion in your brain because of infection, which can be TB or neurocystic sarcosis, you take treatment for that, and you'll not have a seizure again, you'll not have epilepsy again. Even
Yeah.
those patients who have normal, absolutely normal MRI imaging and EEG, they also do well with time. Most of the patients have approximately 50 to 70% of the patients will do
Yeah.
absolutely fine after 3 years of medicines. So there have been a lot of myths about epilepsy, it being a genetic disorder, non-treatable, non-curable, or that it being a divine disorder. And if you have heard that people used to take their slippers or shoes, if somebody has a seizure, they try to put something in the mouth. So all those forms of myths are there surrounding epilepsy, and but all of these are absolutely false, and they are actually myths. They are misconceptions. None of this is true.
How does this stigma affect people with epilepsy?
So, in fact, my thesis during my training was on patients with epilepsy and how many psychological comorbidities are there in patients with epilepsy. So, a patient with epilepsy already is in a state of shock. If somebody has a seizure like this, and if somebody has epilepsy and recurrent fits, is also already in a state of shock and like it's a gloomy state. What happens is the society, if it is not ready to understand it as a disease and takes it as a stigma or a taboo and starts labeling that person somebody else, then there are two things that happens. One is that the patient is not getting treated the right way, which is causing him to have more and more seizures, which is again leading to the same state. So you are kind of in a vicious cycle. The second thing that happens is That patient who is already in a state of shock because of the disease, it has a high incidence of going into anxiety episodes, panic attacks, depressions, and all sort of psychological abnormalities. So it's very important that we go away from the stigma. We don't stigmatize the epilepsy as a disease, and we take it as a disease. For example, the usual example I give to my patients is, for example, if you have asthma, you will use
Yeah.
inhaler. If you have
Yeah.
diabetes, you use insulin or medicine for diabetes. If you have high blood pressure, you use medicine for that. The
Yeah.
same way, epilepsy is just a disease. For example, when I'm talking to you, if I'm not wearing the specs, I'll not be able to see you. But we
Yeah.
don't take it as a disease. We take it as a normal life. If you
Yeah.
remember, I don't know whether you have like seen this or not. In the society previously, there was a stigma about wearing specs as well. People used to say, "इसकी तो नजर कमजोर है, पता नहीं इसके बच्चों में
Yeah.
नजर कमजोर हो जाएगी, इसको
Yeah.
ये नहीं करना, शादी नहीं करना, ये नहीं करना." So all those sorts of problems were there, and the same is true with epilepsy. So what happens in these patients with epilepsy? One, they don't get the right treatment because of a lot of taboos and misinformation about epilepsy. The second thing that happens is it predisposes them to a lot of psychological diseases like anxiety, depression, psychosis, and all sorts of adjustment issues.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, so there are three most common triggers that we encounter in clinical practice. Number one is non-compliance to medication. If
Yeah.
you have been diagnosed as having epilepsy, if you don't take your medicines on time, if you are non-compliant about it, then you can have a seizure. There is very high risk of having a seizure again. Second, not having proper sleep or keeping awake, or like for example, usually you should sleep around 6 to 8 hours, but if you're sleeping late or not sleeping properly, that is the
Yeah.
second cause. The third is alcohol.
Mm-hmm.
These three are the most common precipitating factors of the causes of patients of epilepsy having repeated seizures. One is non-compliance to medication. Two,
Yeah.
avoiding sleep or sleep deprivation. The three, alcohol. So you should definitely focus on these things.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So one of the things is, for example, if somebody has epilepsy and he should at least inform the people around him that he has epilepsy. He should always carry a card with him. For example, if that person is alone, it is always better to have a card so that if you have a seizure and you lose consciousness, at least somebody recognizes you and knows that you have epilepsy and can treat you at that point of time. The other thing could be, as I said, avoidance of sleep deprivation. You should have a proper night's sleep. You should not be waking up early, sleeping late, all those sorts of things. Even if you sleep late, then wake up late. So you should make up for your sleep.
Yeah.
The other things that you can use, if your seizures are not well controlled, you should avoid driving. It is Indian Motor Vehicle Act doesn't allow you to drive when if you have
Yeah.
epilepsy. So you should avoid driving. You should, if your seizures are not well controlled, you should avoid going near water or at heights, or like cooking in a kitchen. So those sorts of things, because seizures by themselves, they never are fatal. Most of the times they are not fatal. The fatalities only happen if the seizures happen in a circumstances where the patient is so much injured because of the circumstances. For example, while cooking, you can burn yourself. If you are near some water
Yeah.
body, you can drown yourself. So all of those things you should be avoiding.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Injuries during seizures. So the first thing is, if you have somebody around you who has epilepsy, and if you find somebody even on the roadside who has epilepsy, the first thing is don't
Mm-hmm.
panic. Don't panic. Relax. Make the patient lie down in the left position or in the right lateral position, preferably left. Don't keep him straight like this. Make him lie down on a side. Then
Yeah.
there are certain, and don't create a lot of people around you. Don't block the air entry around. What happens is, whenever something like this happens, there are many people assembling around the patient. So don't do that. So Just let the air around the patient calm. Don't put
Yeah.
anything in the mouth. Our first tendency is we try to either feed the patient by giving some water or something, or alternatively, sometimes we are putting our hand in the mouth. What happens is when the seizures happens, there is clenching of teeth. If you try
Yeah.
to put something in the mouth, two things can happen. If you put some liquid, it can go in the patient lungs because the patient is conscious and can cause pneumonia. The other thing that can happen is you can injure the patient's teeth if you put something hard, or your own finger if you put them inside. So avoid doing these things. Avoid taking some shoe or some slipper around the mouth. It doesn't help. It in fact creates a lot of unhygienic situation. And there are certain sprays available in the market at present that we prescribe to our patients. You can just give them through the nose, and the patient usually settles. So in short,
Yeah.
just stay calm, turn the patient to one side, don't put anything out in the mouth, don't give anything orally, don't feed the patient, and
Yeah.
let the oxygen around the patient come, and give some spray. That's what you can do if you have a patient around you, or if you find somebody who has epileptic fit in front of you.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So don't stigmatize epilepsy. Epilepsy is a disease just like many others that exist, and we need to treat it in the right way at the right time to make sure that we live a healthy and happy life. And most of the patients with epilepsy are treatable with the right
Yeah.
medicine, and many of them are actually curable. So just remember that do not stigmatize the epilepsy and don't follow the myths.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.